welcome to another edition of LABABY'S Spotlight Show. I remain your hostess, LABABY, and today our guest is in the person of Dr. Alexander Kojo-Boakye Eside. What a name. And he is from Ridge Hospital in Accra, located in Ghana. You're welcome on LABABY'S Spotlight Show.
Thank you.
High five. Here you are. All right, so today we are going to be talking about what kidney failure is all about and its prevention and treatment. Kidney failure. We've been hearing of it a number of times. I'm sure it's not new to you, but some of us don't really know what it entails, and so today we'll be breaking down and digesting it all. So kidney failure, what is it? And we'll continue from there.
Okay, so thank you, and then hello to all your viewers. So kidney failure, we know the kidney, and then when we say something has failed, it's not able to do what it's supposed to do. So kidney failure is the kidney's inability to do what it's supposed to do.
Okay.
And what the kidney is supposed to do is to basically clear waste from the body.
Okay.
So when we say kidney failure, that's basically it.
Okay, so it is when your body fails to be able to clear waste products from your body. Okay. What causes this kidney failure?
Okay, so currently in our setting here in Ghana, most of the causes is from hypertension and diabetes.
Okay.
And then it's not just those who have gotten the early stage, due to long-standing hypertension and diabetes, because these conditions are now very common in Ghana, and they both have various effects that they have on the kidney. So those are the most common causes here in Ghana. But there are other causes, drug abuse. I mean, anything that causes injuries to the kidneys can lead to kidney failure. And then we have two types of kidney failure. We have, when we say a condition is acute, that means it's of short onset. Earliest, maybe onset of just about 7 days to about 2 weeks. But when we say chronic, something that has gone on for weeks into months. So we have chronic failure and we have acute failure. For the chronic failure, just like I said, these diabetes and hypertension. And then for the acute one, anything from bleeding, even just when you have an accident, you bleed, anything at all that has an impact on the kidneys can cause a failure. So that is basically kidney failure.
Okay, under the kidney there are two main, acute and chronic.
Yes.
Chronic is the long term, and acute can happen even just in a split of seconds.
Yes, a short time.
In a short time. Okay, what can we do to prevent kidney failure?
Okay, so prevention is basically from tackling the cause. So first of all, hypertension and diabetes.
Okay, so those are the key.
Yes.
Okay, so someone would also say that, does that mean that if I don't have a hypertension or diabetes, I'm free?
No. So these are the main causes we have, but there are other causes. So for example, you have a young guy who is taking in a lot of alcohol, and we have these days people go on an outing and then heavy alcohol intake regularly. So all these things, you can't really say clearly that alcohol will lead to a kidney failure, but alcohol can give you diabetes after a period of time because of the impact that it has on the pancreas, which produces insulin. So it's basically the two, hypertension and diabetes, that we see often at the hospital causing the chronic failure, and they can also cause an acute failure. So first of all, alcohol consumption, which is very common nowadays, and then people are into various types of drugs and pills and whatever, things that used to happen only in the Western world. Right now they are very common here. So all these things, anything at all that causes injury to the kidney can lead to the failure. So it's quite broad.
Okay, so it's broad enough. Okay, so should I say that the way you live your life, okay, your lifestyle, the things you eat can also bring about kidney failure?
Yes. So even diet, high intake of meat has impact, because when the meat breaks down, the products that come out of it is supposed to be cleared by the kidneys. So it can have an impact. Even bodybuilding
Okay.
can have an impact because bodybuilding produces a certain protein that, if it's in excess of a certain amount, can cause injury to the kidney and lead to kidney failure. Using steroids still on the bodybuilding, people have to use steroids so that they get muscles as fast as they want to.
They say
Have
the
an
ladies
impact on
like
it.
him.
Oh
Guys
yeah,
with
they
muscles. So.
do. So
Is that true, viewers?
so those ones can also lead to the kidney failure. And then high fat intake. Yes, fat intake can also lead to kidney failure. Alcohol, not drinking enough water also, because your kidneys work in such a way that it's always clearing your waste. But
You always have to wash it, so you have to take in a lot of water. So how
Yes.
many bottles of water can you consume in a day, or should you consume?
okay, so at least 7 glasses, and at least a glass is somewhere 500 mils. At least 7 glasses a day, but most people can't do that. So at least you can go with maybe 2 of the 1.5 liter bottles in a day. Just try and drink as much as possible. It's better to overdrink than underdrink. So yes, that's
So water also helps to wash and purify your kidney.
clear the system every time. You're producing urine, you're clearing the waste, and then there's enough blood because the kidney is clearing the waste, but the kidney itself also needs blood to go in there because they also have cells that need energy and everything. Yes.
How many kidneys do we have in the human body?
Okay, in a person who doesn't have any defect or anything at all, 2 kidneys.
Okay. And what happens if I end up getting one kidney as a result of probably losing another?
Okay, so if you donate or through an accident, injury to the kidney, they look at it and they say you have to take it out. Right now I have 1 kidney. Yes, you can live on 1 kidney, but bear in mind that the work of 2 has become the work of 1. So you have to be extra careful. You have to watch your diet, especially also for salt intake also. So anything that will stress that 1 kidney, you have to be careful. You'll be
So
counseled.
it's a whole lot embedded in it.
Yes, because we even with us who have the 2, look at what is happening now, and you have 1. So you have to be extra careful.
So that is to say that we should take in a balanced diet. But you know, it's difficult in our part of the world because here's the case: we have a lot of carbohydrates, we have a lot of starchy foods, these drinks and all. I mean, so much embedded in all this. So how can we do this to have a healthy kidney and a healthy lifestyle too?
Okay, so first of all, personal decision.
Okay.
Because if you want to be fit, if you want to be healthy, it's your personal decision. We have a lot of choices. Fast food joints all over, drinks all over. I mean, these sugary drinks with high sodium in it, and all those things. You have to be able to tell yourself. Well, have people who have gone on no meat for a period of time, just fish. I mean, all those things are possible. It's just a personal decision. Not you being told by a doctor, do this, do that. You have to. You have patients who make that personal decision that they will no longer take any oily food, they will not take any junk food for a period of time.
So it's a personal decision, viewers, that we ought to make that, hey, I'm going to live this positive lifestyle, come with me. I will eat the right kind of foods, do the right kind of exercises, and have a healthy immune system to fight any kind of disease that comes our way. Okay, Mensa also says that I had an uncle who died just walking. He just collapsed and passed out, and the doctor said kidney failure. Is that possible?
Very, very possible. Very, very possible.
Just walking.
Yes. So it's not. Let me say that first of all, there are a lot of possibilities to that. But one thing that's very common also is that kidney failure. When the kidneys fail to clear the system, it can lead to the person getting hypertension. So that hypertension is not the type of hypertension where somebody has the common one, which is quite essential. That means we haven't found any specific cause. So that one is different. So we have hypertension, which could be secondary to something. That means something caused the hypertension. And in that case of chronic kidney failure, which is most likely in that setting, you can have that high hypertension causing a stroke, and then the person can just die. And then that strokes we have two types of stroke. We have stroke that you bleed into the brain, and then we have stroke that maybe something is obstructing blood flow to a certain place. So the one that you bleed in your brain is hemorrhagic stroke, which is bleeding.
Today we are going to release all the terms here.
And then the one that supplies blood to a specific part of the brain is called infarctive. So if somebody has the bleeding one, the outcome is worse than the infarctive one. So it's most likely that he has the failure, he's had it for a while, he's having the hypertension,
But he didn't
not giving him any symptoms, and
Wow.
he had a stroke. Massive one.
Oh,
That one
right. Interesting.
can just lead to that.
It's so much, it's so much, it's so much, it's so much. Okay, and this person said she's MFR Ayato, and she says that my mother died of kidney failure. Does that mean that I am also likely to suffer kidney failure?
Okay, unless we know the cause of the failure.
Okay.
If the cause is from something that's inherited, then you can also get that. But if it's from, just like hypertension and diabetes is ranked in family, so if it's from diabetes, if it's from hypertension, then she's at risk. So she should be screening early for hypertension, checking her BPs at home. Secondly, be checking her sugars, be watching her diet, her weight, everything, because if she gets the diabetes or the hypertension, or even both, then her chances are also high that she will also get the kidney problem also, because the cause is inherited and she has inherited her mother's gene, so she's also likely to get it.
Wow. Okay, so what's the treatment for having a kidney failure? Is there a treatment?
Yes, there is. So the treatment we call is renal replacement therapy, where renal means the kidney replacement, we know, and the therapy is treatment. So renal replacement therapy, two options: whether we do dialysis, which is basically a machine that works like a kidney, clearing out all the blood in your system will go through that machine, and the machine will be taking out the waste at various points. Then we have transplant, where you get a new kidney from someone.
Okay. I hear that the dialysis is very, very expensive. How true is that?
Very, very true.
So that means that if someone is diagnosed of having kidney failure or disorder or whatever it is, and the person has to go through a dialysis, if you don't have money, then they should start taking your grave. Is that it?
The hard truth, that's it. Because if you don't clear out the system, the waste accumulates and the waste can kill you.
Wow, that means viewers, we shouldn't wait to get to this stage, because you don't know whatever may happen. And the funny thing about this dialysis is, how long are you supposed to do it? Is it like forever?
Yes, if it's what we call, we have stages of it.
Okay.
If it's end failure,
Wow.
the kidneys have failed, it's at the end. So there's nothing that cannot be. Like that kidney has failed, there's nothing at all. The best is a transplant. But whilst you wait, you are eating, you are a person, so you are still producing the waste. So they do dialysis at least twice in a week. And it's very expensive, and it can drain you. I mean, we have superstars who trained all their money just to do dialysis, and eventually to the person.
It means we don't have to wait. We have to really wash our kidneys very, very well, drinking a lot of water, at least 500 ml in a day. You should take 7 or 8.
7.
Okay, 7 of it. That is when you've not even taken crab before the day ends. And let's look at the transplant. Sorry, you taking in someone's kidney. How is it like? Is it anybody at all that you can take their kidney, and how does it work with you?
Okay, so any type of transplant, liver, it's basically taking somebody's organ into your body, but just like a blood transfusion, you should be a match.
Okay.
And then even though you're a match, the body has an immune system that fights off anything foreign. It's not just an infection, anything foreign. So when you, even after everything is set, the person is a match, the person might even be a relative or something, you're a match and everything. you need to be put on medication that will suppress your own immune system until your body, with time, gets used to that organ. Because if the body is in that state and is rejecting the organ will not be able to function well. The body will literally attack that organ and it will destroy it, and then
there's also a mass that.
Yes, but there's medication that you can be taking, and then they'll follow up on you. Yes, just like heart transplant, kidney transplant, everything, any type of transplant, you need to be taking those medications for some time so the body takes that organ, now recognizes that it's on, and then you can live with it.
So that means if we get you, there are two main ways you can treat it. Dialysis and transplant. There are no other ways left.
No.
Wow.
But the treatment, this for when we can't do anything about the kidney. So now if we can slow down the progression depending on the stage you've got into. So if it's maybe we have various stages, we have about 5 stages of it. So if you are maybe stage one, then not necessarily that's the end of it for you. Stage 1, your kidneys are working, but it's not working up to the normal person's capacity. So they try and find out what's causing this chronic failure. Is it poorly controlled diabetes? What's the next thing to do? They put you on medications. If it's tablets, insulin, they put you on it, and then they make sure that your sugars are fine, because the high sugars that will lead to all these complications. So they just about, if it's hypertension, making sure that your BPs are fine. If it's from drugs that maybe you're on some chemotherapy for a cancer or something, they make sure maybe they pause for some time, they monitor your kidney function. So it's about the progression of it. So if you can catch it early, somebody with a chronic kidney disease stage 1 could maybe live a longer life than somebody who even has some other ailment, just because it has been caught early and the person is following. And then salt intake is very important.
Hey, so that means we should check our salt.
Yes.
Some of us, we can't do away with salt, so, the chicken, the everything. They will make sure that the salt has entered. I'm say salt in my, but please, we are listening today and we have heard that we should try and minimize our salt intake too, so that we will protect our kidneys as well. Any other thing before we wrap up?
Okay, so they're still on the topic of the salt.
Okay.
Salt is not just the table salt that we use. We have these junk foods high in sodium, burgers, pizzas.
So indirectly, he wants to tell us that stop taking junk foods.
Yes. So the salt is not just so people will be like, oh, I want my salt, and everybody, the person binging on Coca-Cola, burgers.
You know, as for me, even at the point I thought that it is, I don't really take salt, so I'm free. But he drawn our minds back to some of these things that people thought is not really.
And then spices. Spices have even more sodium than even table salt. Spices.
No, we've changed it. We say natural spices.
So,
the
natural spices, maybe the purely natural spices are fine. So you could go with those ones, but it's the sodium that's killing a lot of people. The high sodium diet, the fries. You can taste it. It's very, very spicy.
It's really nice.
So you have people who would even just grind pepper and they'll add maggi to it and all those things. Those are very high sodium. And all these things affect the kidneys, and then you'll bring a whole lot of. And when it comes to kidney failure, no money. I mean, you can be very, very rich, but it will drain you. It will drain you, because anything about the kidney is expensive. Transplant, dialysis, medications that you have to take, you have to undergo a whole lot of changes. You yourself, you go through a lot. So it's better you prevent it. Try to stop it at the stage where it can be managed, and then live a good life.
Okay, viewers, we have heard it all. Live a good life. I mean, we have heard it. We've heard it. Some of us crowd. We didn't know some of the things we have released today. Myself, I cooperate with let's try and live good lives. Let's reduce our salt intakes. And today we've heard that salt is not only about the salt that we used to cook and we say, oh, we don't add salt to our diet and all, we've reduced it and all. But the burgers, the fast foods, the junks, the fact that they have increased amount of sodium inside, it has an effect or adverse effect on our health. So let us know that, and let's drink a lot of water. Drink water. Tame yourself. Drink water. At least every hour you can drink water. If you can't, but make sure that 7 bottles they've consumed in a day. Thank you very much for enlightening, and God richly bless you. Acknowledging our sponsors. If you're looking for the best house to get your perfumes, ladies products, hair products, hamper packages, surprising services, the number to dial is 050-871-2689, 050-871-2689, or check Instagram or Facebook, LABABY'S House. And if you're looking for the best house where you could get your quality dog food for your dogs to keep protecting your homes for you, the number to dial is 020-8174602, 020-8174602. Thank you very much. See you some other time. Remember to stay healthy, live healthy, and be a spotlight in the void of darkness with us. Bye.